support scheme ESS is now ready. Last week, I announced a series of improvement measures, and yesterday, the relevant colleagues held a technical briefing. Today, there will be a dedicated website. You see the website address here. This will be launched today. The date of applications is from the 25th of May to the 14th of June, 3 weeks in total. This is for the first tranche of wage subsidy for June, July, and August this year. Last week, we had received over 20,000 inquiries at our hotline, 1-836-122. And then the hotline will remain in operation, of course, to take calls. As for ESS, it's really a matter of urgency that we do it, because the government is going to announce the latest unemployment figure for the quarter, February, March, and April. 2 days ago, the Financial Secretary already gave notice. April was the month with the most stringent social distancing measures. So the impact of unemployment was, of course, the biggest. That's why the FS already said that in April, the unemployment figure would soar. So that's why today the announcement for the unemployment would be that it has soared. So the situation is still worsening. That's why we hope the ESS would play a role in preventing unemployment from getting worse in Hong Kong. Now, there are some sectors particularly hard hit, those sectors related to consumption, tourism, catering industry, hotel industry, retail industry. And I've always said that the ESS is about giving immediate relief, so that it must be simple in terms of application, and it must be quick in disbursement of cash. So that's why you would note from the website that applications by employees are really simple. There are just 3 steps, and there's an agent to deal with that. We just need a bank proof for receiving the funds, and otherwise, most of the time, the employees could just ask the MPF trustees to submit information to the central processing agent for supporting the application. Here, I would like to thank 2 groups of people who've helped to make the ESS possible. First is the MPF trustees. Because employers would not need to give the headcount of employees, their wages, and so on. Rather, their MPF trustees will be providing the certificate for that. And then last week I said, if you recall, we want to lessen the burden on employers in making the application. If MPF trustees submit the certificates to the government, all the relevant administrative fees would be taken up, paid for by the government. But then soon after, all MPF trustees indicated they would be providing this service for free. In other words, they are not going to charge any fee for this effort on their part for this scheme. And another group I'd like to thank is these processing agents. The agent has done a huge amount of work to launch the scheme. Thank you. And then next, I want to talk about our control measures in relation to the epidemic, because another batch of social distancing measures will expire this Thursday. Now, for 23 days straight, during a certain period, there were no local infection cases, and then we had a cluster of a family of 3 cases. So far, for these cases, the Department of Health has not been able to trace the source of the infection, and of course, for this group, there's no travel history. We need to remain vigilant, but there's no need to panic, because WHO experts or local experts tell us until there is a vaccine or until there is herd immunity, it is impossible for this virus to just vanish. So there will be community infection for a long time to come. That's why our strategy now is mostly about preventing imported cases. So, we have stringent testing process in place when people arrive at Hong Kong before we send them home for 14 days of mandatory quarantine. And the other strategy is, of course, to prevent a community outbreak. The two strategies will make sure that we don't have a major outbreak in Hong Kong. At the same time, we will make sure that our healthcare system, public healthcare system in particular, would not collapse because of the large number of infections. But then, as experts pointed out, the 28-day is not a rigid indicator. It's actually unrealistic. If we have to wait till we have no local infection cases for a period of 28 days before we relax certain measures, it may be impractical. Now, for social distancing measures to expire this week, that has to do with CAP 5991, some restrictions on certain business premises, and then there's certain businesses that still have to remain closed. And then for 599G, we have gathering ban for groups of larger than 8 persons. So we'll be making announcements soon. But to decide on the next step to take, last Saturday, I called a meeting of the expert advisory panel. The 4 experts believe that so far our effort in fighting the epidemic has been effective. We need to remain vigilant, but then there's no need to panic. So that's as what I said. But then they think we should maintain the status quo. There is no need to relax any other measures, but at the same time, there is no need to tighten other measures too, such as the decision for classes to resume in May. I mentioned the 2 regulations, so what are we going to do next? Later on, the Secretary for Food and Health will be making an announcement. Now, the steering committee has asked the Center for Health Protection to make extra effort on certain matters. Now, we have local infection cases, so the experts have strongly advised that the government must step up our testing capability and expand the scope, because we need to know what the situation is like with as to whether the virus is in the community. Now, with this latest local cluster, experts said it's nothing surprising, because it is possible that we do have silent carriers in the community, or people or asymptomatic persons who've been infected. So starting from January, our testing scope covers patients who go to the HA facilities, accident and emergency ward, and then to outpatient clinic, and then eventually the test extended to private clinics and to people coming back from overseas. So we have done 190 tests so far, but we need to do more. So we need to test people who show no symptoms, and even people who haven't been to any of the healthcare facilities. Now, the Center for Health Protection does about 2,000 tests a day, and that's far from adequate. In fact, at one point I did ask for more tests to be done because our testing capacity is 4,500 now, but we can't use up the total capacity, because there may be a sudden emergent case, and then we need to do a large number of tests. For example, for the Lei Mok Shu case, that's led us to do 2,000 tests in a short period of time. So now our daily testing capacity is 4,500 tests. So what we need to do now is to boost the capacity to about 7,000 tests, as suggested by Professor Yuen Kwok Yung. So how are we going to do it? We have the plans in place. The public laboratory under the Department of Health would be buying additional equipment. The 2 medical schools of the Hong Kong University and the Chinese University will also be buying additional laboratory equipment through fundings from us. And thirdly, before we have additional equipment, we will extend the service hours of the laboratory on a need basis. At the same time, we have approached private laboratories. Hopefully, they could also boost their testing capability, because there is a certain demand in the community for such tests. And for priority groups to be tested, there are currently 2 broad categories. But then we are constantly exploring how we could extend that. The first group is people working at the airport, because most of the cases are imported cases. For people who work at the airport and who may have a chance to come into contact with arriving travelers, then they are the first group. You might recall before the 19th of April, there was another local infection case. It was a lady who worked at airline at the airport, and we were unable to trace the source of infection. That's why we believe for those working at the airport, they are the first group to be tested. And then another group is about people who work at private and public homes for the elderly and the disabled, because if carriers are infected, they could pass on the disease to the frail, elderly, or disabled persons, and the consequences could be dire. That's why this is another priority group we have to test. As I said, later on today, the